Raw botanical and mineral substances often carry severe physical toxicity that must be safely mitigated before treating human illness. Practitioners also face the challenge of patients presenting with deep-seated, recurring chronic illnesses that readily resist superficial treatments. Selecting a safe, effective remedy requires a systematic connection between these raw materials and the patient's specific susceptibility. The first step is drug proving, establishing a remedy's pure dynamic effects. The second is drug dynamization, the pharmaceutical preparation delivering a safe minimum dose. The third is the theory of chronic diseases, a framework mapping out deep, recurring disease patterns. Mastering this three-part integration map allows a practitioner to move beyond superficial symptom matching, building a foundation for precise individualization and long-term holistic care. Drug proving is the systematic observation of a medicinal substance's specific pathogenic effects on healthy human volunteers. Testing on sick patients introduces what homeopaths call disease noise. A healthy baseline is strictly required to isolate the pure dynamic action of the medicine without confusing it with pre-existing symptoms. During a trial, provers meticulously log physical, mental, and emotional changes, paying close attention to specific environmental or situational factors that make those symptoms better or worse. This diagram outlines the symptom evaluation phase. Common or pre-existing complaints are filtered out, leaving a hierarchy of characteristic data. At the base are particulars. These are localized physical complaints targeted to specific tissues or organs, like a sharp pain in a single joint. The middle tier holds generals. These reflect whole-body physiological responses, such as thermal reactions, cravings, or shifts in sleep patterns. The top tier contains mental-emotional symptoms. Alterations in mood, perception, or memory hold the highest diagnostic weight when individualizing a case. Provers also record concomitants, simultaneous symptoms with no direct physiological link to the main complaint. These distinct pairings serve to individualize the remedy choice beyond common clinical indicators. Once evaluated, these confirmed proving symptoms are integrated into the materia medica, the comprehensive record of remedy pictures used to guide clinical prescribing. Approving does not dictate an automatic prescription. It strictly builds the pure observational dataset required for a practitioner to make a similarity-based comparison to a patient's exact symptoms. Early homeopathic practice faced a clinical dilemma. Crude medicinal doses produced severe toxic side effects, yet simple, unagitated dilutions proved clinically ineffective. The solution developed was dynamization or potentization, a standardized pharmaceutical process of serial dilution accompanied by systematic kinetic friction. For insoluble raw materials like solid minerals, this process is called trituration. The substance is ground with pure lactose in a mortar for specific time cycles until it achieves biological activity. For liquid-soluble substances, the solution undergoes succussion, rhythmic and forceful impacts against a firm surface, creating thousands of microbubbles. This chart compares the three primary mathematical dilution pathways used in homeopathic pharmacy to create distinct potency scales. The decimal scale, denoted as X or D, uses a strict ratio of 1 part substance to 9 parts vehicle at each step. The centesimal scale, marked with a C, is the traditional global standard, utilizing a 1:99 ratio for every serial dilution. The 50 millisimal scale, labeled LM or Q, employs a multi-step preparation, achieving a 1:50,000 ratio, designed for gentle, daily administration. In formal terminology, dynamization must not be described as increasing chemical concentration. It is a process that reduces material density while developing dynamic action. Dynamization serves as the sole pharmaceutical mechanism linking raw material preparation to the core philosophical principle of delivering a safe, individualized minimum dose. Even with accurate, well-proved remedies, early practitioners observed a relapse paradox. Patients often experienced returning symptoms or developed deeper, recurring complaints over time. Acute diseases have a rapid onset and are generally self-limiting. Chronic diseases display an insidious progression, continuously recurring because the vital force cannot heal the system spontaneously. This timeline illustrates Samuel Hahnemann's theory of chronic diseases, which postulates that these persistent illnesses are driven by deeper, underlying dynamic susceptibilities. These underlying predispositions are called miasms, inherited or acquired tendencies that shape exactly how a patient reacts to environmental stress and pathogens over a lifetime. The first classical miasm is psora. It is characterized by functional disturbance, physiological lack, extreme hypersensitivity, and dry, itchy skin eruptions. The second is psychosis, a pattern marked by excess, cellular accumulation, structural overgrowth like warts, and a tendency toward retention. The third is syphilis, which drives patterns of structural collapse, severe tissue degeneration, and deep ulceration. Even with an accurate miasmatic analysis, healing can be blocked by obstacles to cure. These are maintaining causes, like occupational toxins or severe emotional stress, that hinder recovery regardless of the remedy prescribed. Miasms provide a classical framework for long-term case analysis. They must never replace modern medical diagnosis, rigorous safety standards, or necessary biomedical referrals when red flags appear. Let's apply this to a clinical vignette. A 34-year-old software developer presents with recurrent, itchy eczema on both elbows that has persisted for 4 years. Looking past the acute skin presentation reveals key chronic background elements. The patient experiences extreme anxiety over deadlines and a notable hypersensitivity to cold. This diagram maps the patient's specific symptom cluster directly to the classical miasmatic categories to identify the underlying susceptibility. The presentation firmly aligns with the psoric classification, driven by the functional nervous anxiety over deadlines, hypersensitivity to temperature, and a complete lack of structural tissue destruction. We can also identify clear obstacles to cure: the severe ongoing workplace stress maintaining the illness, and a history of suppressing the natural outward eruptions with topical steroid creams. To proceed safely, the practitioner must now consult the materia medica, relying strictly on the pure pathogenic data from drug provings to find a remedy picture that matches this specific psoric totality. Prescribing for the skin alone ignores the patient's deeper recurring pattern. Holistic care is achieved by integrating the pathogenic data of proving, the pharmaceutical process of dynamization, and the long-term framework of the miasm.